So today's topic is going to be varicose veins and management of varicose veins. Excuse the mess around me. We're moving, so I didn't clear up around me. But I just want to start off by saying there's too many, in my opinion, too many procedures being done for varicose veins. You see these vein clinics that are popping up all over the place, and their main goal, again, in my opinion, is to do procedures on people. I won't say that for every single facility, but I see this way too many times. For example, I saw a patient the other day, I live in Dallas, who came to see me for a second opinion, and she'd been seen at a vein clinic, a vein and vascular clinic. Uh, and it's been recommended to her that she have 4 procedures performed on each leg. Now, that, in my opinion, is really overboard. There's no rationale, really, for doing 4 vein procedures on each leg, short of the fact that each time you do a procedure, you get paid for it. And so, in my experience of doing this for a long time, I started doing vein procedures right from the beginning when the endovascular vein procedure was being performed at first. I learned from going to a course at Jose Almeida in Miami, and that was good 15 plus years ago, before all these vein procedures became so popular. And so at most, I've treated 2 veins at one time, when I thought it was really necessary. And the good thing about that is, yeah, if 2 veins need to be treated, you can do it at the same time. The why people are splitting it up into multiple procedures is when you do both procedures at the same time, you get a discount on the second procedure in terms of your reimbursement. But if you split it up, you get the full amount. And so, just heads up to people: don't, be careful about what you go through. But having said that, I mean, there are really good indications for vein procedures. But last time we talked about vein physiology and why people develop varicose veins. Remember, there's several risk factors for it. Family history. Women tend to get it more than men, particularly women who had multiple children. Occupations you sit or stand. Those are really the main things that lead to varicose veins. And the problem with pregnancy, particularly, is I tell my office ladies that wear support stockings because they're on their feet. And then I recommend to people who have a family history of vein problems is when you get pregnant, wear support hose, because the blood volume and the hormonal changes of pregnancy sometimes irreversibly affect your veins. And so what happens is the damage is done is earlier on in your life, but then you show up with the problems, 10, 15 years down the line with a bunch of varicose veins, which are ugly or painful, or you have a lot of swelling, intractable swelling. So, prevention is the key, especially with a strong family history of varicose veins, or if you're on your feet all day, nurses, physicians, cosmetologists. Actually, my number 1 clients right now for vein problems are actually CPAs. It used to be physicians, nurses, postal workers. Now it's CPAs and truck drivers because of the time they spend sitting. So anyway, symptoms of vein problems: aching, swelling, heaviness to the legs, and it can be mild, it can be significant. You can have minor varicose veins that are significant. You can have major varicose veins that are not significant in terms of symptoms. And so the key is correlating the symptoms with the physical examination findings of varicosities. When you start to get brownish discoloration in the skin, that's what we call venous stasis disease. And unfortunately, that's irreversible. You start getting a lot of brownish discoloration. That's almost like tattooing of the skin. It won't go away no matter what treatment you do. Even if you ablate the vein or get rid of the vein, it may make the skin color changes better, but it won't make them go away completely. So pain, swelling, discomfort of the legs, sometimes restless legs, particularly at nighttime. Patients complain of kind of uncomfortableness and heaviness. They tend to thrash around a lot. I know I get that if I don't wear support stockings, because I've got vein problems from standing all my career, 29 years of surgery. So I have vein problems too. So a support hose is really important. Conservative management is always what you want to do first, not kind of get into why. Okay, why conservative management? It's because sometimes patients' symptoms will be taken care of conservatively. So you always want to do that before you jump into aggressive approaches. There's downsides to aggressive approaches. So conservative management is one, exercising. Start a regular walking program. What does that do? When you're physically active and exercising, the calf muscles have a pump mechanism that pushes the blood flow back up. Think of this as a problem where when you're sitting or standing, everything's backing up into your legs. So when you exercise, the calf muscles pump the flow back up. You want to get it out of your legs. It's coming down fine. It's having a tough time getting back up. So one, regular physical activity or exercising, using your calf muscles particularly. Biking, fine. Thigh muscle exercise, fine. But really calf muscle exercising is what I recommend. And the 20 to 30 minutes a day is plenty. The key is the regularity of it. It's not, going for a long distance run one day and then doing nothing for the next 5 or 6 days. It's regularly exercising to keep that blood moving upstream rather than sitting in your legs. So one, regular physical activity, exercising. Number two, prop your legs up. Kind of makes sense, right? If you elevate your legs, gravity then is your friend. If you sit with your legs down, because of all those ruptured valves that we talked about in your veins, everything's backing up on you. So when you prop your legs up, everything drains out of your legs. You want to get it out of your legs. Okay, so exercising, prop your legs up. Weight control. Most people that I see with vein problems, their vein issues are not not caused by their weight, although that can happen. It's more that if you carry extra weight, it makes the whole system work harder, right? It kind of makes sense. If you carry an extra weight, the system has to work harder. And then you have to talk about, why are you gaining weight? Are you careful about your diet? Do you do thyroid hormone check? Do you have a family history of certain, these kind of issues? Always important. So exercising, weight control, prop your legs up, support stockings. So whenever I say support stockings, everybody thinks of these, the ones that grandma used to wear, the big thick ones. That's not necessarily true. There's a lot nicer ones nowadays. So what I recommend is if you're in your working kind of phase where you're up on your feet a lot, you're still working, 20 to 30 millimeter mercury pressure stockings is what I recommend. And you have to measure them for you. You have to get them measured for your size because not everybody's calf is the same size. Ideally, should be thigh high, but it's really difficult to wear thigh high hose. Most people wear knee highs, and I think that's fine. And because most of the discoloration from vein problems occurs at the knee or down towards the ankle. So exercising, weight control, prop your legs up, support stockings, 20 to 30 millimeter mercury pressure measured for you. If that's too uncomfortable, which I'd say about 40% of people can't stand wearing them, 15 to 20 is fine, but they have to be measured to you. There's medical grade ones and then there's the lesser ones. And then 8 to 12 is okay, not quite as good for that. Spider veins, I think you can get away with lesser compression socks, 15 to 20s. So that's the mainstay of conservative therapy, a good 3-month trial of doing that and see how you do. If your symptoms get better, great. The veins will not go away. The whole point of conservative management is to help you with your symptoms, okay? And if that doesn't help you, then think about getting a more aggressive approach. So before we do ablation of the saphenous vein or getting rid of the saphenous vein, we do a duplex scan to evaluate to make sure there's no unknown problems with the deep venous system like old clots that you weren't aware of, which does happen occasionally. But we really want to assess the function of the valves that are in the veins, the superficial vein system. We want to see how well the valves are working, if they're not working, if they're overstretched, how much reflux there is. We measure the reflux in milliseconds. And then we measure the size of the vein. And there's certain criteria that we use for ablation of your vein, or essentially lasering your vein. And so if your symptoms are not well controlled conservatively, think about getting the ablation procedure. What's the downside for the ablation procedure? Not a whole heck of a lot, initially at least. So the biggest risk of having a deep vein blood clot, that's pretty unusual. Depending on how low you go in the treatment site, you can get what's called neuropraxia, where there's a nerve right next to the vein that can get injured. And so you get a lot of tingling with it. I mean, that's really the biggest downsides to me. The upside is you can get rid of your symptoms. Okay, and so what I counsel patients is, look, if your symptoms are mild and it's not really limiting your physical activity, the quality of your life, don't get the vein surgery done. For myself, my symptoms are well controlled conservatively, so I'm not going to get the vein surgery done. But if it's really bothering you and you've tried conservative management, think about getting it done. So what's the deal about getting this done? Why am I so hesitant in this? Not hesitant, but counsel people to really think about things, because what a lot of these vein centers won't tell you is you will get some more varicose veins down the line. I mean, you will get some more. Now, they may not be as severe as you have right now, but you will get some more. So before you go through a vein procedure, think about that. There's a potential, I'd estimate about 5 to 10% of people come back for more work on their veins within 5 to 10 years. And that may be an overestimate, but still, how bad is it bothering you? Do you want a more aggressive approach? The downside of not having varicose vein surgery is not a whole heck of a lot, apart from the aesthetics and the discomfort. So, can you get a DVT or a blood clot in a deep vein system from having superficial varicose veins? Yeah, you can. Pretty unusual. The signs and symptoms of that will be, like, for example, you wake up one day and your leg's really swollen. You need to see your surgeon for that. Or more likely, you wake up one day and your vein is red, hard, and hot, one of those superficial veins. That's a superficial phlebitis. That isn't a deep vein thrombosis. That's not the dangerous stuff, but you still need to be seen to make sure that superficial phlebitis doesn't extend into the deep vein system, because there's connections between the two, as we talked about. So that's the biggest deal. So what are the absolute indications for having vein surgery done? Well, there are a couple. One is, intractable symptoms despite conservative management. I think that's fair enough. But if you develop what's called a venous stasis ulcer, an ulcer at your ankle can be typically on the inside part of your ankle, sometimes on the outer part, depending on the vein that's the problem, then it's a good idea to have that vein treated with a laser or radiofrequency, or even a glue to seal it down. And so why? Because we know that if you've had a venous stasis ulcer and you have superficial vein problems, you can get the ulcer healed up, but you have about a 50% chance of having another ulcer somewhere down the line. Whereas if you get the vein treated, then you have about a 9% risk of having another ulcer. So it does make a big difference. It also makes a difference in terms of healing. So you heal it quicker, because these ulcers can be quite painful. And the typical, not typical, but I've seen this a lot. People come and say, look, I got a brown recluse spider at my ankle. And you look at their ankle, it's discolored, typical venous stasis disease. They have a wound on their ankle. It's painful. It's not really a brown recluse spider bite typically. It's a venous stasis ulcer, and it can happen spontaneously. You'll be just doing fine. Next minute, you'll form this little scab sore, and all of a sudden it'll spread and get red and irritated. That's a venous stasis ulcer. It's really, brown recluse spiders are pretty unusual, causing an ulcer right there. So most of them are venous stasis ulcers. So in situations where you have an ulcer, fair enough. Or other situations, apart from the intractable symptoms, despite conservative management, if you have bleeding. Now, it's really unusual to bleed from varicose veins, but you can. And normally you cut a vein, it's a low pressure system, so you just kind of ooze. But with varicose veins, you can bleed. You can bleed a foot, it could shoot out about a foot. And the typical case scenario here is, I got out of the shower, doc, looked around, it was like a hog slaughter. There was blood all over the place. So that's a pretty typical bleeding episode. Now, I'll see maybe one every 3 or 4 months of these. If that ever happens, by the way, wrap your leg up with an A-strap, butt on the ground, legs in the air for 30 minutes, it'll stop, because all the blood drains out of your legs. But that vein, which normally is under low pressure, just because of the vein valve problems, is under high pressure, and it'll shoot out about a foot from your ankle if you're standing upright. So don't be surprised if that ever happens to you. Wrap it up, butt on the ground, legs in the air, it'll stop. Then in that situation, I think it's a good idea to have your saphenous vein treated, because you will bleed again. You have a much higher risk of bleeding again. So ulceration, intractable symptoms despite conservative management, bleeding, repeat infections, cellulitis of the skin. Cellulitis is a superficial skin infection. So these legs tend to swell, and the swelling leads to wounds and also infections. The swelling contraction leads to a lot of the dryness of the skin. And so the bacteria that live in harmony with you can get in through the cracks in your skin and cause skin infections of cellulitis. So, cellulitis can be mild, where it's treated as an outpatient, or it can be pretty significant, where you get very ill from it. But repeated cellulitis, in my mind, is a good idea to go ahead and treat the saphenous vein, because why? You want to control the swelling so you reduce your risk for cellulitis. But once you've had cellulitis, you're always at risk for getting more of it no matter what. Same thing with venous stasis ulceration. It's just the risk is decreased by ablating the saphenous vein. It doesn't get rid of it completely, but it really does decrease the risk. And cellulitis and venous stasis ulcers, by the way, can be quite painful. So in those situations, I think it's fair enough to have the treatments. In terms of the ablation procedure, I really need to spend a good 15 to 20 minutes talking about the procedure itself, what it involves, what to expect. Again, this is not a sales pitch. I'm not looking for more work. I'm towards the end of my career, but I want people to understand what they're getting into with these things, because it does bother me a little bit with all these varicose vein clinics all over the place. Again, I'm sure there's really good ones around that do the right thing, but I'm just concerned about the number of people I've seen who've been told they need a vein procedure. I'll tell you a perfect example. I got a call once from an out-of-town, let's just say a business broker, who wanted to buy our practice. And I kind of looked at it, and I talked to the principal, and he said, "How many vein procedures do you do a month?" And I have been around for a long time. I've done a lot of veins. And I said, probably about 20, 30 a month. He said, "That's not good enough. You need to do at least 100. I went, well, slow down there, partner. So, think of the rationale for going through a procedure. What's the risk-benefit analysis, and make an informed decision before you go through these procedures. So next time we'll talk about vein ablation procedures, and I'll kind of guide you through what that involves in the postoperative recovery.